Chair now recognizes Ms. Castor for 5 minutes.
Well, thank you all for being here today. And if the gentleman from Georgia thinks it's unreasonable for the federal government or the state to tell pharmacists about when they can prescribe medication, then certainly you are outraged about it forcing girls and women to remain pregnant against their will. This is outrageous. Or forcing doctors to contradict their ethical codes and their medical training. But here we are. I want to tell a story about one of the first women in Florida affected by the 15-week abortion ban. In Florida, the 15-week abortion ban went into effect just recently. It's on top of a 24-hour mandatory waiting period. I heard this through an ultrasound technician in Tampa who said that Sue was a mother, had just given birth. She had a 4-month-old at home. She and her husband went back to work quickly because it's not easy out there these days. She was then, when she went back to work, diagnosed with COVID. She went to various urgent care centers, and they said, okay, you're nauseous, you're vomiting, you have chronic fatigue, you're a long hauler. After a number of weeks of not getting better, she took a pregnancy test, and she was pregnant with an infant at home. She scheduled the soonest possible appointment available at Planned Parenthood, where the ultrasound confirmed that she was 16 and a half weeks pregnant. So now it was too late for her to get an abortion near her home. She, a mother of a newborn who's recovering from serious illness, facing financial pressures, now has to work with her healthcare provider to go out of state, ask her employer for more time off work. This is an example of how extreme these policies are and how extreme it is for politicians to think that they know best for this family. The emotional strain it's causing, the financial instability, the interruption of bonding with her infant. Dr. Verma, you said in your testimony that mandatory waiting periods have no medical purpose. Do you agree? Do you confirm that?
Thank you for that question. Yes, there's been extensive data that has looked at waiting periods and shown that they do not make the care safer. They do not change that people are sure in their decision to move forward with an abortion, and they are not medically based.
And then these abortion bans, you said, I believe you testified that this is going to worsen health outcomes for parents and families.
Yes, absolutely.
Dr. Guerrero, do you agree with that? And is this story, do you think this is going to be a unique case, or is this going to be what we're dealing with here for months to come?
I absolutely agree with Dr. Verma has said, and I think we're going to see a lot more of this happening in the months to come. It's one of those things, again, where lawmakers make this assumption about pregnant people that they somehow don't know what's best for them, or that the barriers and restrictions that are in place are not having a significant impact, when in fact they are having a very, very critical impact.
And Dr. Resnick, to think that now these abortion bans and what states are doing now to criminalize the advice that doctors are giving to patients or the care that they would like to give. I mean, what are doctors across America thinking about now as the recourse?
They're very worried, and our recourse is limited. The information is not clear. There's a lot that's going to still be worked out in litigation. You know, the example you shared and the other ones we've heard today are very real and are consistent with what I'm hearing from colleagues around the country. And it just reflects the complexities that my colleagues face every day. Most people I know who are physicians wouldn't have gone to med school if practicing medicine were easy. They actually chose it because it's complicated and hard, and you get to sit down and try and solve problems with patients. And sometimes in reproductive health, that is a choice to continue a pregnancy. Sometimes it's an ectopic that you discover that you need to treat. And so I think my physician colleagues around the country who are dealing with those complexities every day with informed consent and sharing their expertise with patients are doing heroic work, and I am very worried about the possibility of seeing some of them prosecuted for that heroic work.
I agree. Thank you very much.